Welcome to the Java Cafe, Java fam. Good morning. You're listening to Java with Jimmy.
Well, I got it together now. Good morning, everybody. Good morning. Good morning. Today is Tuesday, August 16th, 2022, and you are in the Java Cafe for another episode of Your Healthy Java, which is sponsored by the Massachusetts General Hospital Office of Equity and Community Health. And we're going to talk about a subject, and if you've known me for a long time, you know this wonderful smile has been paid for. So dental health is hugely important. It's important in general. And then with all the attention that we've been bringing to other sicknesses and other things that we're dealing with our health, we're going to learn today how, and like mental health, dental health, and every part of our body's health is important to our overall health. And so without further delay, I would like to bring in our medical director and also co-host, Dr. Claude Alabre. And you're not new to the cafe. You know the routine, sir. Good morning.
Good morning. Good morning, Jimmy. Good morning, listeners.
How are you doing, sir?
I'm doing well, thanks. How are you?
I am doing well. I see you got a wonderful fresh cut there and whatnot. Dr. Labre looking wonderful.
Right.
You're doing it, sir. So we're talking about dental health today, and you as a primary care physician. Just real quick, from your perspective, why is it so important that we include our mouthpiece in our overall review of being healthy?
I mean, the quick and easy, it's part of our body. You can't take it out. And you pretty much said it. It is. What's that?
You got to give me just a little bit more.
I know. I mean, you've said it. It is part of overall health. And we do know that dental health is critical and have interplays with what we traditionally, I guess, consider health in terms of illnesses, as you mentioned, how we feel, and everything else. And so it is important, has always been important. It hasn't been always considered as important, but so that's part of the reason we're bringing awareness to this still, unfortunately, and how it can impact us. And I think we will find out a little bit more about what it means to have good dental health and how that can affect us when it's not as good as it should be.
Absolutely. And I won't be too transparent today, but if things come up, I will definitely be willing to share. And so without further ado, I'd like to bring our guest into the room this morning. He is a doctor. His name is Dr. Ross Isita, not Isita, Isita. So good to see you in the room this morning. Thank you so much for your flexibility, because you are actually in the office seeing us between patients. And so we definitely appreciate it. So Dr. Ross, please introduce yourself. And we'll just talk a little bit about why dental, but please introduce yourself. Tell us a little bit about yourself.
Sure. I'm Ross Isita. I'm an attending dentist at the Mass General Dental Group. So I have a little bit of a niche. I practice hospital-based dentistry. I do see outpatients in a clinic that's open to the community, but we also see patients who are medically compromised. We do inpatient rounds through the hospital. We consult with physicians throughout the hospital whenever they need dental questions answered, consultations pre-surgery, and we oversee a couple residents here. I've been here at MGH for 7 years now. 7 years. So yeah.
You looked up, I thought you were going to say about 20, 25 years. You only look about 30.
Not quite yet.
But Dr. Isita, why dental? Why that specialty? Why not cardiology, surgery, and you probably do some form of surgery, but why was dental so important to you?
Dental is an interesting profession where you get to be very hands-on. You're in as far as in the field of medicine, often there's a discrepancy between the diagnostic and surgical wings. As a dentist, you do both. I like building things, to be honest. I've always liked building things and technology. Dentists as a general group do enjoy those things. But then also it's a way that with very, you can make a very big, meaningful impact in someone's life by fixing their smile.
Absolutely.
And I mean, I've had, so many huge emotional experiences, and I see people's lives turn around as they see me, and we get them to overall health, and oral health is part of that. And it's just extremely rewarding. So dentistry is a great career, and we need dentists. So.
Look at you, see it exude out of you. And Dr. Labre, we might have one of these aha moments, because what I did hear from you, Dr. Ross, if we could just do 30 seconds, we definitely talk about mental health, and you talked about the smile. And I'll be very honest with you, I wouldn't be able to do this show if I didn't have a good dentist. And actually, my last dentist was there at MGH. But just talk about 30 seconds about the impact you when people get their smile fixed, and it's a part of their overall health, which mental health is a part of that. So can you give us about 30 seconds of that impact on folks' appearance, because it is important.
Oh, for sure. I mean, there have been studies, and they measured it, around 30 people who are seeking jobs or interviews feel like they have missed opportunities because of the quality of their smile. So having a forward-facing, nice big smile gives you confidence. It helps you be articulate with your speech. It's very hard to have a positive presentation without good oral health.
Okay, so we're out because we could go down that rabbit hole. So I will behave. And so one of the things that we're going to talk about today is, by your observation and seeing, what are the number one concerns you're seeing with patients. They're in more of the outpatient, and specifically within like Black and brown communities.
Yeah, I mean, patients have concerns. I mean, through the pandemic, I've seen a very strong uptick of stress-related oral health issues. Lots of jaw pain.
I'm sorry. Okay, you're going to give examples, because I didn't know there was stress-related dental. So stress can impact every area of. All right, Dr. Locke, this is going to be good.
Sure. I have patients calling with tooth pain, which is actually referred from muscles and joints. We as human beings tend to hold a lot of tension in our jaws, and that can cause cracked teeth, severe pain, required extractions. I've had to, send patients to get over-the-counter mouth guards to help reduce that pain, and just having a conversation about it. And you're saying the mental health aspect of it. Mental health also does show up in, as if someone is very stressed, it shows up in your teeth and jaws. And then, of course, just the constant need and for cavities and gum issues. That's basically the big two of all the dental maladies is caries, tooth decay, and gum disease, periodontitis.
Wow. Dr. Labre, is there any correlation from like when folks present with you, they come into a medical appointment, but either they reveal that they're there and don't have a dentist, or you obviously may have seen someone, you can tell they're in pain. And I did not know, Dr. Isita, that like stress can really impact your jaw. Like, thank you, because we often focus on, if there's an infection, someone quoted or commented that it could lead to heart disease, but stress wears on the body, and even through lack of good dental hygiene or good dental health. Interesting. Dr. Labre.
Actually, I wanted to ask Dr. Asida a quick question. I noticed that you've been rather specifically referring to oral health as we've been saying dental health. I wanted to hear are you drawing a distinction? Is there a different sort of way you in the dentistry world sort of approach oral health as opposed to dental health?
Wow. Good question.
Yeah. So not really. I think oral health is part of overall health. So it's just recently, I think it was 2019 Surgeon General's report, somewhere around there, finally came out and said that you cannot have oral health or overall health without oral health, and vice versa, which was actually not even kind of considered in the medical field. And that's why there's always been sort of two different silos of medical and dental care. And just in the last 10 years, finally, that thinking is just starting to change. So I don't think there is a distinction. I think systemic diseases, we can see them, their first manifestations, they first show up in your mouth oftentimes. And then definitely oral health conditions, periodontitis, caries leading to tooth decay. There's a strong correlation between gum disease and cardiovascular disease. There's a strong correlation between uncontrolled diabetes and periodontitis. Infections in the mouth are, it results in, I think it was like $65 billion lost in productivity. The number of school hours is 34 million school hours are lost due to tooth pain decay. So it's not just, it's part of, your overall health, but also it affects the social determinants of health as well, right? So you need a healthy mouth in order to lead a healthy life.
I think that's one of those. Dr. Labrie has this thing that he said in one of our first few sessions, healthcare matters, get it where you can. And you just said, well, that quick, Dr. Labrie, what did he say? Oral health. Say what did you just say, Dr. Labrie?
I'm not sure. What did I say?
I'll be able to go back and but you said something there that we're definitely going to use as a logo, as a what do you call it? Model here in the Your Healthy Java Cafe.
We'll go back and watch.
Absolutely.
Right.
Absolutely.
Yeah, and to answer your question, Jimmy, earlier too, in terms of how we in primary care or in medicine sort of deal with these sort of things, it is really interesting to see how separate we have been for a long, long time. Oral health, sort of dental health, and medicine. There's starting to be more of a merge, and as Dr. Asida just said, now we have a hospital-based dental care where before, I don't want to go back too much into history, but when sort of dental care first started at Hopkins, I believe there was a big sort of fight over whether to include it in the medical field or keep it separate. So anyways, we've been separate. But interestingly enough, I get very few questions about dental health in primary care for routine care because people also think that we don't have any connection or we don't understand it or we don't do it. So they don't bring it up. I have started in the past maybe 2-3 years to bring it up and actually ended up getting a bunch of cards to the MGH dental group in my office so that I can actually hand out. And it's still not part of our daily questionnaires to ask people, do you see your dentist? Are you getting your prophylactic? And I think it should be included in our overall. We ask the million questions about social determinants of health and all kinds of questions, but not a single question about dental health. So I think we still have some work to do in that field. I'm starting a little bit on my own, but this is really interesting.
It is so interesting, and I'll be very I told you where possible, I'll be transparent here. I had a heart murmur when I was younger, and anytime I had a dental appointment or they thought there was a cavity or possible infection, I actually had to go to sometimes the medical side and get the antibiotic. I unfortunately have dealt with the tooth. It's so interesting to hear what can contribute to tooth pain. And so I've had to navigate and call the medical side and say, hey, I think I have an infection. I need some antibiotics kind of to take away the pain, because another thing, and I don't want to jump all over, but folks will be quick to pop a pain pill over tooth pain, not realizing that pain pills aren't going to fix it if you have an active infection anyway. You're the dentist, so I won't go into that. And so we did get the saying, Stan, thank you so much. We're walking away with the motto, you need a healthy mouth to lead a healthy life.
Oh, there you go. Someone's listening. That's awesome.
That's what we're leaving with today. And also Dina from Roxbury. Actually, I think she works at MGP. I know someone who the dentist sent them directly to the doctor because they knew they had a health issue. And so, Dr. Ross, if we could stay here for a minute, what are a couple of examples, or one maybe, where Dr. Alabre talked about more intentionality between medicine and oral health. What are examples, or what's an example of someone should see their doctor either first and or their dentist at the same time, so they are taking care of their overall health?
Mm-hmm. Well, I think, working in conjunction always is the best way. I know that it's very difficult to, sometimes connect with both, your MD and your DMD or DDS, your dentist. But I think the proper care is always done in conjunction. I think I'm lucky to practice in this health system where our records are connected. I can interface with every physician, every specialist immediately. Yeah, epic. So it connects us in a way where I think having a unified medical record, I think, is the way that healthcare can improve, and is sort of slowly moving that way right now. So I think that you can't consider one without the other, and vice versa. And so, and I have been, every time I see a referral from a patient's PCP, I'm always so happy and feel great that they're looking through it. I've actually spoken to groups of physicians about what to look for and how to do an exam. And so it's something that I'm very passionate about, and I'm happy that, I think we all need to work as colleagues to render appropriate care.
Absolutely. I have a motto across the board: communication, coordination, and collaboration. Will get us through absolutely everything. One of the other things, and yes, we'll get to this question later, Dr. Isita. I told you that this will be kind of the number one question. Dr. Isita taking new patients. We'll get to that, Auntie Java, in just a few moments. But one of the other things that, while there's change going on within the industry, I think patients often sometimes feel, and here's a comment here, a lot of people don't have the proper insurance to get the care or work they need. Dentists are very, very expensive. And so, Shalon or Nika, we're going to go back toward the end. We are going to name a couple of schools here where you can go and get some free dental care. And so, Dr. Isita, let's get on the other end of this. What are some of the preventative things? Now, we all grew up. Brush your teeth, when you get up, before you go to bed, brush your teeth after every meal. I came from the generation where they came around with the platter of fluoride, where we used to rinse and spit in the school classroom back then. And so there are some preventative measures that we grew up hearing about. But can you just review a few of some of the preventative things that we can do to keep our overall health healthy through our mouth, so we can have I got to go back and find the saying, but you know what I'm talking about.
Yeah. So, prevention, as always, is the best medicine. And I find that, a lot of my patients who are showing up in the clinic who have the biggest issues, they just never actually had someone sit them down and tell them, this is what's going on, this is what you need to do, and this is why you need to do it. So I'm happy for the opportunity now. So brushing twice a day for 2 minutes, okay? It's okay if you cheat a little bit in the morning, but at night, brush for a full 2 minutes. Okay. Ideally, it would be after meals. Okay. Nothing to eat afterwards. All right. So when you're brushing, make sure you go right along your gum line, one pass, hit your gums everywhere, and then go around the tops of your teeth. Okay. Make sure you get every surface of every tooth. You got to spend a little bit of time on it. I always say brushing your teeth is like driving a car. Everyone thinks they're the world's best driver, but nobody's good at it. Same thing with brushing. Everyone's thinking, oh, I brush my teeth. Great. I hit everything. No, nobody's good at it. You have to be really systematic and go tooth by tooth by tooth, hit every surface. And then floss once nightly before bed as well. I myself got into trouble for not flossing. It happens to the best of us. Okay.
Wait, what?
Yeah. Yeah. So the best thing is to use is a big long piece of string. But I use the picks, and that's out of, I know that I won't do it if I don't use the little picks. Yeah. So I use the picks. My wife thinks it's gross, but I leave one on my nightstand. I leave one by the computer.
Is she a dentist as well?
No, she's not a dentist. No. So I leave one by my nightstand. I leave one by the computer. I see it. I feel guilty. I'm like, oh, just got to do it. You don't need a big ritual about it. Boom, just go through, do your teeth, put it down. That's all you need to do. Okay. So ideally nightly flossing. All right.
What about the flossers? I've found these to be life changers for me.
Oh,
I
for
know I
sure.
feel a little guilty that there's a lot of plastic because it's disposable and the handle and all of that.
Yeah.
I don't know how green it is, but if it's gonna make me do it, I mean, it's so much easier. What do
Oh,
you
for
think?
sure. Yeah. Oh, for sure. Yeah. Whatever you can do to reduce friction to healthy habits, do it. So, and I reuse them. So to get more eco-conscious, reuse it till it breaks. Just give it a rinse. Okay. It's fine. It's
Wait a minute,
fine.
we are really having. I said we want to get one more person, more transparent moment. We're really doing that right now in real time. Sir, so brushing, I'll be a transparent moment. I think we get in the habit of just I'm listening to you and I'm like, oh, I'm 50 years old and may not necessarily be brushing my teeth right. We get in and we do, and for some of us, we do it as either a first action or last action. And we get in, we think we hit everything, we do it quick. I make sure I turn the toothbrush around, get on the inside and whatnot. But you really say we really need to pay attention to how we brush our teeth and then also flossing as well. What are some other preventative measures?
Well, seeing your dentist regularly.
What's regularly? Okay.
So every 6 months is a recommendation.
Not once a year.
Not once a year. So the dirty truth of it is that this 6-month recommendation came from an advertisement in like the early 1900s about brush your teeth twice a day, see your dentist twice a year. Then that's where it comes from. But it just evolved into being a best practice. So now that being said, some people are lucky and they've got low bacteria in their mouths and they can actually get away with a little bit longer interval. And some people are less lucky and they've got gum issues, things like that, worse bacteria in their mouths that are more aggressive, and they need to see the dentist every 3 to 4 months or so. So I think seeing a dentist who does a thorough exam and then developing that baseline for yourself, and then you can kind of then decide what's the best interval for you. But seeing your dentist every 6 months is definitely a critical part.
Okay.
So that's individualized. There's not a standard, because I had heard at some point that people with diabetes or certain conditions should be every 4 months. Is that or is it really individualized?
It's individualized, but I think it's with diabetes. If it's not really diabetes, it's more that the fact that if you have any gum disease at all, then it's more important to more frequently cleanse the bacteria out from under your gums, so that way it doesn't cause a progression of the gum disease. But the idea is that you do these cleanings more frequently and eventually get graduated to being seen every 6 months, which is the standard.
And what is the evidence on mouthwash?
I was Dr. Labre. Thank you. I heard flossing, and then I was thinking of the fluoride, and I'm like, and we kind of got away. Thank you, Dr. Labre. So, mouthwash. We won't name brands and whatnot, but yes. What is there any benefit? What mouthwash? Let's go down that road.
So mouthwash, I recommend anything with fluoride and preferably alcohol-free. So we have a microbiome with a bunch of bacteria in our mouths. That just swishing with some alcohol, killing off bacteria just as a blanket isn't necessarily the best thing for you. But getting a rinse in there with the fluoride, that actually helps remineralize and strengthen your teeth. Your teeth are actually, believe it or not, like a crystal in your mouth is a way to think about it. And it can dissolve, and remineralize, right? So by getting fluoride regularly on your teeth, and I usually recommend doing a rinse nightly, make it the last thing to touch your teeth, spit, and go to bed. Just let it sit in your teeth. The longer it sits in your teeth, the more that the hydroxyapatite becomes fluoroapatite, which is the mineral that is your tooth. It becomes more resistant to acid. So over time, throughout the day, as you're, just saliva and water in there, the fluoride washes out, which is why it's important to get it on your teeth. Now, you don't need to swallow it, okay? Swallowing it does help young children who have their teeth developing inside of their jaw, but for adults, it's only a topical effect.
Okay.
So fluoride is a huge, the fluoride was like almost the birth of public health. They discovered fluoride as a mineral in a water supply, and they discovered that these people had bad looking teeth because they had way too much fluoride in it, but their teeth had no decay. And so they discovered that the fluoride ion really helped prevent decay. And so communities with community fluoridation in their water is one of the most protective things that can happen for your teeth. And so getting that exposure, especially for young children, is essential, and has some carryover for exposure for adults.
So let's do a quick review on a preventative end. Brush your teeth twice a day. And at night, make sure for at least 2 minutes, but please be sure at night to brush for 2 minutes and let that be. Now, I'll say this based on what you just said. Let the brushing be the second to last thing. Then, well, we'll figure out the order here. Then you got to floss. But then I guess the very, very last thing you should do is at night, rinse with. So if I heard you correctly, if someone was listening today and they use, because my preferred mouthwash begins with an L, which has a lot of alcohol. And so would you recommend doing that kills the bacteria and then doing a fluoride rinse after that?
Well, I would make sure that whatever rinse you do has fluoride in it. So
okay.
If you really, really like the burn and you feel like you're doing something good, which I don't recommend, you can do it. But you know, essentially what you're killing off is all the bacteria that's just sort of floating around your mouth. You know, the really virulent, deep anaerobic stuff that the rinse doesn't necessarily get down to is still going to sit there. So that's why the alcohol is sort of, you know, unnecessary step, in my opinion.
Okay.
And I think you're better off just being able to not have that burning sensation that makes you want to spit it out, but actually do the rinse for a minute, spit, and then just let it sit in your teeth overnight. Yeah.
And then nothing else to eat or go to bed. Okay.
Just go to bed, let it sit on your teeth. Yeah.
Got you. We're going to maybe speed up
on the. Sorry, Jimmy, you mentioned you were sort of going back and forth with brushing and flossing. Any difference if you floss before you brush or brush before you floss? Does it matter?
Okay. There's the real answer, and then there's the. So we are always recommended to tell people to floss before brushing. And the main reason is because you're more likely to remember to floss. Whereas if you're tired at night, you brush your teeth, you're like, that's enough, I'm off to bed, you know. But
so no formal medical reason.
Yeah, so that's the reason.
Okay.
But floss. Trust me on the floss.
Okay.
Just make sure you do it. I don't care what order.
All right. I'm going to start just bringing up some of the questions, and I'm going to do them in reverse because there are so many. The L makes it non-alcoholic. I'm sorry. One of the things that Thaddeus is asking, listening in from Boston, can you floss too much?
So yes, you can actually hurt yourself with too much oral hygiene. So I mean, if you are doing it in an abusive fashion, I always say proper hygiene, if you want to do more of it, is lighter, longer. So brushing pressure is just enough to depress a finger pad is all you need. If you're really pushing hard, you could actually hurt yourself. And with floss, you don't want to saw or feel like you're itching or really go. You just want to go through, gently make a C shape around each tooth and come up, and you're basically trying to slide the floss between your tooth and your gums and pull out any little bacteria you can get. You don't want to pull down hard or anything like that.
There's just
speaking of pressure, because we know a lot of the sort of electric toothbrushes have a built-in sensor so that if you push too hard, it'll flash or vibrate or whatever it does to warn you. I wanted to also hear your thoughts on using electric brush versus manual. I know we here talk a lot about equity and affordability and whatnot, but in the end, you might be saving if you have something that's going to last you a while, except for changing toothbrush heads, which you also can speak to. How often you recommend switching toothbrushes? There's a lot of questions in that one, so if you can unpack this for me.
Sure, yeah. So you can be just as effective with a manual brush as you can with an electric brush. However, I do recommend a rechargeable base electric brush, okay? For two reasons. The biggest reason is actually because it has a timer. You click it on and it doesn't turn off until 2 minutes elapses. So it tells you when 2 minutes is. And I tell you, 2 minutes is a long time. You don't think it's a long time, but it's a really long time. So that's the main benefit. And the fancier models do have pressure indicators, which I find extraordinarily helpful as well for patients who can be more susceptible to causing damage on their teeth due to overbrushing because they have a lot of exposed root surfaces. So yeah, I do recommend electric brushes, but you can be just as effective with a manual brush. I usually teach a stationary jiggle. Okay, so you just hold the brush in a position, half on your tooth, half on your gums, and just kind of vibrate it, and then move to the next tooth over, do it again, next tooth over, do it again. It takes a little bit more work, right? But and then as far as toothbrush heads, I go to the trade shows and I get the fanciest model because they give it to us at cost as they're trying to get us to tell our patients to use them. But so my model tells me when to replace the head, and it tells me way too frequently to replace the head. So if your bristles are looking frayed, okay, and weak, then replace the head. Okay. If they're still straight and they look the same, keep using it. You're going to be fine.
And is that the same for a manual brush? Because there's
same for a manual brush.
Okay.
Exactly.
So there's no standard necessarily of you need to throw out your brush. I've heard as frequent as once a month. I've heard every 3 months. So there's not really a time standard. It's more an individual and observation of your brush. If it's manual, and then if you can afford, as Dr. Laubrie mentioned, equity and things like that, the sensor will tell you when to switch it. Even if Dr. Isita believes that they're telling you too early because they want you to buy more. There was something.
Speaking of, sorry, one quick question. Speaking of oral health, just general health, not just the teeth. What is the recommendation on brushing your tongue?
Before we do that, Dr. Laubrie, just if we could stay water picks while we're in that vein, can you just talk about that, and then we'll talk about the brushing of the tongue.
So water flossers just recently became ADA accredited. So when you're looking for products, you should look for things that are supported by the American Dental Association, the ADA. Okay. So they'll have like a little emblem on them, and it's meant that the American Dental Association has reviewed the science behind this product, and the claims that the company is making is actually verifiable. So start with that, whatever you're looking for. Okay. Water picks are great for patients who have gum disease, for patients who have a lot of recession exposed roots, patients who have a lot of restorations, and it can be a great adjunct, a great additional thing to do on top of brushing and flossing. I don't believe it should ever replace flossing. There's a new product that recently got ADA accreditation is for a water flosser. I actually don't have a lot of experience with these. I'm more of a traditionalist. So I still say, hey, like maybe if you're doing it the perfect way, it works just as well. But I believe in mechanical. Get something in there. Do the tried and true method. But there are some products. And the science is relatively new on the effectiveness of the water flossers. Of course, a lot of industry people are probably going to come after me, but that's okay.
One more, and I think we kind of covered it a little bit. Deborah, let us know if you have a deeper question, but I think Dr. Ross just covered that while maybe we're asking. Tay is asking, and we'll go to the tongue, but just this brush tools still in that vein. Is a soft or hard brush better?
Soft or extra soft? Only.
Really?
I don't know why they sell the harder brushes. Don't use them. Again, your question is, can you damage your teeth from brushing, flossing? Yes, you can. And so soft or extra soft. It does mean that you'll have to replace your brush a little bit more often. But if you're using appropriate pressure and using a soft or extra soft, it's going to bend and get into all the grooves in the appropriate way. And you won't wear away your own tooth structure if you're using a soft or extra soft.
I'm learning. I'm walking away with so much today because my philosophy was, I got a little electric one, and the harder you get in there and kind of, and I do the jiggle. So at least I got one affirmation today. I'm doing the jiggle. I do try to go tooth by tooth, but interesting to hear soft versus, because we just think that harder and more rigid, just like the alcohol in the Elf's mouthwash. So to Dr. Laubrey's question, the brushing of the tongue cleaners. Can we talk about that for a couple of seconds?
Yeah, tongue brushing. So people have all different forms of tongue. So there's these papilla, which are just like little, finger type things
Yep.
on our tongue. And some people have longer ones, some people have shorter ones. So some people, you are hearing this and they're like, what's going on with this? Because they probably have shorter papilla on their tongue, so it's not an issue. Some people naturally have longer papilla on their tongues. And so bacteria can get into those grooves. I think that cleaning your tongue is more of probably a breath issue. It's not going to really affect the rate of cavities or gum disease or anything like that. So I would do it gently, just like all hygiene, lighter, longer. Okay. So you can incorporate scrapers and brushing into your oral hygiene regimen, and it's not a bad idea. But just be gentle about it.
Wait a minute, so hold on. Don't take the suppressor as far as you can bury it back there.
Yeah.
I'm learning so much today. All right. So one quick question for me, when you said it's more a breath thing, a transparent moment. I drink coffee, I like cheese and stuff. And so sometimes in the evening I have used the tongue scraper. And based on what was scraped, what do you mean it doesn't contribute? Because seeing what comes out on that and, listening to you today, I'm like, oh, Jesus. And so it doesn't hurt is what you're saying.
It doesn't hurt. It's going to reduce the amount of bacteria. But as far as like cavity causing and gum disease causing bacteria, you have to realize that in your mouth, there's, hundreds and hundreds of types of bacteria. I mean, there's millions and billions of bacteria in your mouth, but there's lots and lots of types of bacteria, some good, some bad, right? And so controlling the bad bacteria that's in intimate contact with your teeth, so touching your teeth or under your gums, that's, sort of my aim, right? Okay. Clean the other bacteria, doing the Listerines, tongue scraping, things like that. That's going to help socially, right? But as far as preventing disease, it's not as critical as a thing. But we can talk about diet and cavities real quick. If
we can talk about that too, but I just wanted to say sorry to Uncle Thaddeus. He just spent $150 for a water flosser thinking it was better. Damn. Sorry, Uncle. Well,
it's better if you are using it. So if the 150 makes you use it, then it's the best. Okay. So
if that helps, man.
Use, yeah.
So diet, and you said diet and nutrition, or diet
and cavities.
Okay, let's go.
So, all right. So I'll give my quick cavity talk. So what causes the cavities? Bacteria. Every time those bacteria get sugar, they produce an acid for 20 to 40 minutes. That acid digs a hole in your tooth. Okay. So to minimize cavities, number one, so you have to minimize bacteria, right? Brush, floss. We covered that pretty well. Step two is to think about diet. So what I always tell my patients, and the good doctor is going to yell at me about it, but if you eat your whole body weight in sugar in one go, and that's your only meal for the whole day, okay, you'll get diabetes and it's going to be very bad, but you'll have very low risk for cavities, okay? Because that's only one time that the bacteria is going to be making acid for 20 minutes, okay? So that's the lowest possible cavity rate if that's how you live your life every day. But if the opposite, if you eat only a total of a cube full of sugar, but you do it a couple grains every 20 minutes all day long, even though it's almost no sugar, it's the highest cavity rate possible, okay? So you got to think about diet, in that, patients always ask, oh, can I eat this? Can I eat that? And it's like, well, what I tell patients is I don't really care what you eat. Okay.
Don't say that to Dr. Library.
I know exactly. That's why I said I was going to get in trouble. I don't care what you eat, but think about the number of times or the length of exposure if you're worried about cavities. Okay. So it's all about the bacteria making acid for 20 minutes. All right. So sipping on sugary beverages, no. Okay. So I got in trouble with sugar in my coffee, so I had to cut that out. Okay, so is I would sip coffee all day long, so that way I can do my studies and things like that.
Hold on. So from the first sip that I took earlier that has sugar in my coffee, my teeth are now going through a 20-40 minute process.
Yeah. The bacteria are eating the sugar, producing an acid as a byproduct. It kills off other good bacteria, and it digs a hole into your tooth where the bacteria live. That's a cavity. Okay. So think about it's not how much you eat when it comes to your teeth and cavities. It's how frequently or how long the exposure is.
So
and then the last thing is fluoride. Fluoride works in the opposite way. So we talked about that a little bit earlier. So the longer the fluoride sits in your teeth, the more it remineralizes your tooth and makes it more resistant to decay. So these things exist in a balance. And that's why oral health is just constant daily maintenance, you know.
One of the things that I like that you said was, and my next, because I'm not a new patient at MGH, so hopefully I don't have to wait. But you mentioned a little bit about a little while ago toward the beginning about actually sitting with the patient. Like if someone has heart disease, if they have diabetes, if they're going in for surgery or transplant, there is a plan. They get a nurse case manager or something. And in dental health, when you go for that exam, and God forbid you got a whole bunch of stuff going on, your dentist should be sitting with you with a plan to get you better. Is that correct?
Exactly. Yeah. So I think it's important to, when you do new patient exams, I try to educate, you know. Not all providers have time. The clinics are set different ways and it's difficult, but I think education is the most critical piece, which is why I'm very happy to be here on your program. So I think that, you know, oral health is so much about daily maintenance. It's really just about self-empowerment, right? So if you just need to put the work in, and then that helps prevent disease. And you know, there's lots of access issues. It's, you know, difficult to find a dentist. It's difficult to see a dentist. It is expensive. I saw a comment roll by about that.
Especially if they're on the orange line coming Friday, but go ahead.
Especially if they're on the orange line. You know, it's very important to try to connect with routine care, at least get a baseline. I think a lot of patients who have limited access wait until they say like, oh, well, I don't have any problems. Nothing hurts. It's like, no, like if something gets to the point where it hurts, you've got a big problem.
Right.
Decay, when it's very small, you don't know that it's there. Okay. Nobody knows that it's there unless you see a dentist, you get a full exam, you get the x-rays, the radiographs. That's critical to establish that. So, you know, there are resources. We're lucky that in our state, we have 3 dental schools. Okay.
You all listen well if you have issues with insurance right now.
Yeah. Dental schools are an amazing resource for reduced fee service. The honest truth is it does take a long time. Okay. You get excellent care, probably some of the best care that you can get, even though it is done by students. But it's overseen by amazing faculty. But it does take a little bit more of a time investment, so be prepared for that. But if you haven't been to the dentist in years, the time to go is as soon as you can. Okay. I'd also try to connect, if you don't have any dental coverage, and around 30 to 40% of adults have no dental coverage, you may qualify for dental coverage through the state, Mass Health, which actually has recently expanded their benefit. And so provide a lot more services. So try to connect, go on to mass.gov and try to connect with getting Mass Health Dental. And that'll be an amazing benefit as well.
I'll go ahead, Dr. Larber.
Right, I was going to say, is it all 3 dental schools in the greater Boston area? So there's Harvard, BU, and Tufts.
Exactly. Yeah, sorry to mention that. Harvard, BU, and Tufts, and they all accept patients from the community, and you get great care at all 3. You know, so I'm a Harvard instructor myself. I did go to, and I also went to Tufts.
And Tufts has one of the I don't want to get in trouble here, but MGH is Harvard affiliate, but Tufts has a very wonderful reputation, just like Harvard.
Yes. And, as a Tufts trained dentist, I can attest. Yeah, but BU is good too. BU is good too.
And Harvard as well.
Lots of friends from BU. So yeah, Harvard, BU. They're all great. I would go whatever's most convenient to you based on your location. And whatever clinic hours are the best. I know some of them have evening hours, things like that. So make the calls. But, you know, accessing dental care, you know, cost. There's also like psychological factor. You know, it's like the fear of going. Okay.
And the fear of knowing what the dentist is going to tell you, what you already kind of know.
Yeah, exactly. But dental problems, like all problems, the longer you wait, the worse they get. Right. So you just got to show up. Some people have had bad experiences with dentists in the past. That can be very difficult to overcome. But so it does take some bravery to show up sometimes. But I always say just replace that. If you find the right person, you can replace that bad experience with lots of small, little, easy, good experiences until we're all comfortable working together, and then we'll get you there.
Absolutely. One of the things that I wanted to mention, this comment here, is to attest to the fact that you can have healthy teeth. And Debbie says, my dad used a toothpick to floss. He always had a toothpick after every meal. His doctor was amazed that he had good set of teeth in his 80s. And so it is possible to have good dental hygiene for your entire life. And the other thing I wanted to just bring up, that Uncle Thaddeus, along with his spending his $150, he said, man, this show going to stop people from kissing. I'm going to go leave that right. Well, for a quick second, Dr. Ross. So how much is morning? So all the kids should be kids are back in school, right? No. Can oral sexual activity have an influence on your dental health? Did I frame that well?
Sure. Yeah. Yeah. I mean, as far as any communicable STIs, there are some things that can be transmitted. Okay. However, there's, as far as affecting,
say what you need to say, Dr. Ross. Just say it. We're good here.
Affecting gums and your cavities, things like that. No.
Really? So because when I was a HIV AIDS teacher, I had put this little anecdote together, and I asked, can you catch HIV from eating chips? And people were like, no. There was this rumor going around that Cool Ranch Doritos, because of one of the seasonings in them, they cause microscopic, little rips in the gum or whatever because of whatever. And so it was interesting to hear you say, and if if the person had Doritos, they got the microscopic cut, they went and had oral sex, that would be an opening. It's not, if people have, microscopic cuts, or if they're a hard brusher, they're getting ready for their date and then they go and do what they do. I'm not trying to put words in your mouth, but I just want to be sure we understand. I don't want folks to walk away and think they're good. They can go out there and be doing everything and it not impact their mouth. But do you?
Yeah. So I mean, risk of transmission is low. I think Dr. Labrador
really?
Can go more into that.
Okay.
I say risk of transmission is very remote. For especially like HIV.
Okay.
I mean, there are
other STIs.
herpes viruses and gonorrhea type things. They can be transmitted more easily through mucocutaneous contact. So like contact inside your mouth, something.
Say that slowly. What?
Mucocutaneous contact. So like it touches a mucus membrane. Okay. Yeah. Sorry. So and so those are more catchy. But as far as HIVs, it would be extraordinarily rare. But we can let the good doctor answer.
Yeah, I mean, I think the point Jimmy was making was, if you have openings, if you have cuts, so there's potential for exposure into the bloodstream. Again, rare, low, because it doesn't happen as easily as it may sound. But yes, that risk would certainly be higher than someone who's got an intact mucous membrane gums. But what Dr. Aicedo was saying is that it doesn't impact your teeth itself or caries, the things that we've been talking about, outside of the already known STIs that you can get, like gonorrhea and things like that, including HPV actually, which can also, now we know, lead to throat cancer and other things. And so these you can catch, but not dental effects per se.
Right.
Got you. And I'm paying attention, but I'm just trying to make sure we got all the comments or questions here. I thought Stan asked a question earlier that I said I would ask at the end.
We're talking about decay and things that can be erosive to the teeth. So you mentioned sugar. Is there also a concern for acidic food? And then the other one is there's been a lot of debates about teeth whitening. Does that actually erode the enamel? Does it cause problems? Does it lead to more caries? or is there a frequency that's acceptable and one that is not?
I'm glad he asked that because I heard, and I love orange juice, and I heard that orange juice was not good all the year. I mean, by the gallon, sir, just a half gallon rather, just would kill it in like hours. I heard things about like sipping through it. So sugar and Lord Jesus, where were you 40 years ago, Dr. Ross? So the straw sipping, and I think we covered all the questions, and so I think we're good. But while you talk about that, I'll just go and make sure we got
Sure. We haven't covered gum disease yet, which we can go to real quickly. But also, okay, so acidic foods, yes, acidic foods are not good. Anything with a very low pH, something very acidic, will work synergistically with that acid created with bacteria, created by the bacteria, and they'll work together to cause cavities. Like I said, you can eat or drink whatever you like, in my opinion, as far as cavities are concerned. But try to avoid anything overly sugary and overly acidic, which perfectly describes orange juice. Okay, so
I can't even sip a coffee now because that's sugar.
You can eat or drink whatever you like, but just don't do it all day long. Don't have lots of exposures. If you do drink something acidic, I want you to enjoy whatever food you want, but then rinse your teeth out afterwards. Let the pH neutralize, and then you can do some oral hygiene.
Okay, gum disease real quick because we got about 2 minutes.
Okay, gum disease real quick. So
3 minutes. Go ahead.
Yeah. So patients always get concerns like, oh, I stopped brushing here because my gum started bleeding. Okay, which is kind of the opposite thing that you want to do. Okay, so you're
face, Dr. Labre, who's like,
So gums are bleeding. Okay, usually because they have a source of irritation, and that source of irritation is generally speaking bacteria under your gums. Okay, so if your gums are bleeding in an area, it means that you should do that lighter, longer. Brush right along there, take care of it, try to cleanse out the bacteria, reduces inflammation. Okay, so what gum disease is, and I've never seen people with like really long looking teeth. It's a slow progressive loss of the bone and the attachment around your tooth, and your teeth can eventually become loose. This process usually, so there are aggressive forms, but it usually takes a very long time to happen. And it's so something that you don't even notice because it just slowly creeps up on you. But essentially you have like a low grade infection of your gums, and that puts your body under an enormous amount of stress. And that's where a lot of the linkages between oral health and systemic health come in, with cardiovascular disease, with uncontrolled or poorly controlled diabetes, stroke, low birth weight, having this constant source of chronic infection in your mouth that goes untreated, puts your body under a lot of stress. So essentially what it is when your tooth gets under your gums completely covered with bacteria, your body looks at your tooth like it's a splinter because it sees all this bacteria. Your gums are so thin that that they see the bacteria. They're trying to fight it. It thinks it's inside your body, but your body can never actually clear it out because it's not in your body. It's just between your tooth and your gums. So basically your body's trying to push this infection away. So it's a correction in the body's mind, right? The body's trying to say like, oh, this is bad for us. Let's get rid of it. But you want
which is elevated white blood cells, right? Which can cause
so it causes a whole inflammatory cascade, elevated white blood cells, increased cytokines, all this kind of stuff that's not good for your whole system. So basically the only way to get rid of the bacteria is cleaning under your gums, right? So going to see a dentist, getting the bacteria scraped out from under, so that way your body no longer perceives your tooth like a splinter, it perceives it like a tooth, right? And so the inflammation goes down, the bleeding will go away.
Dr. Labre, these are just getting better. And I said last week, the couple of weeks ago, the one was good, but this was good as well, because it's when Dr. Labre brought it up, I was like, yeah, we haven't really talked about this. And there's so much correlation between having a healthy mouth, and I got to go back up and find, Stan typed it out for us, but we're going to walk away with that. A healthy mouth, something I'll find. Oh, here it is. This is what we're going to leave with. You need a healthy mouth to lead a healthy life, period. That is just it. And so, Dr. Isita, I thank you so much for being with us today. Dr. Labre, as always, thank you. Folks, just a note, this is a longer month, and so we do first and third Tuesdays. We don't have a first Tuesday for about 3 weeks. And so we're also going to let you know some things we're doing in September. And also, please save the date. Saturday, October 1st, right now, Saturday, October 1st, we're going to highlight a year of your healthy Java, and we're also going to come together praying that these numbers stay okay as far as COVID. We're going to come together and do a couple of panels, and we're going to have a Your Healthy Java resource fair. MGH is going to come out and other health initiatives, and maybe if dental has an outreach, Dr. Ross, we can work with trying to get them there, or at least some pamphlets and information. But just keep that in mind, October 1st. And I think that's it for announcements, Dr. Elaborate, right?
Yeah.
Okay. All right. Again, Dr. Isita, thank you so much. This has been, we've had very, 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 very good sessions, but this one here, I think folks are really walking away. I mean, I'm walking away with so much, and don't be surprised if you get an email. I'm like, oh my God, I'm sitting here. I'm like, okay. But thank both of you so much. And folks, we will see you on September. Let me get my phone. Hold on. September 6th, which is election day. Well, me and Dr. Labre will figure it out. But we're scheduled to see you on September 6th. But if not, we'll see you on September 13th. And we'll figure that part out. But definitely save the date of October 1st. Everyone have a great and awesome day. And thank you for tuning in. And Dr. Labre, I'll be in touch. And Dr. Asita, you'll probably get an email from me. Y'all have a wonderful day, everybody, and thank you for tuning in to Your Healthy Java. Thank you.
Thank you, and bye, everyone.
Bye-bye.